Welcome to this resource on understanding pediatric glomerulonephritis. We will cover some helpful information you may see on exams and do practice questions at the end. But first, welcome to Artemis Interactive Media. Artemis is your guide to learning resources and continuing education. You may note a heart at the top of this resource to indicate a condition often covered in pediatric courses, with the color indicating the body system. This quick timeout is a short study break and will cover understanding pediatric glomerulonephritis. If we need any help, Artemis will be here to guide us. Glomerulonephritis is inflammation of the glomeruli, which are the filtering units of the kidneys. In children, this condition commonly occurs after a streptococcal infection, such as a strep throat. Inflammation interferes with kidney filtration and may lead to fluid retention and elevated blood pressure. Children with glomerulonephritis often develop hematuria. This causes the urine to appear dark or tea-colored. It's often described as smoky-colored urine. They may have edema, especially around the eyes and face, which is common due to fluid retention. They may have hypertension, and decreased urine output may also occur. Children may have a history of a recent strep infection. Nursing care focuses on careful monitoring and supportive management and includes closely monitoring the blood pressure, daily weights, which should be taken at the same time every day, the same clothes with the same scale to ensure accuracy, and intake and output should be monitored closely as well. Fluid and sodium restrictions may be necessary, and children are often encouraged to rest during the acute phase. Medical management may include antibiotics if streptococcal infection is present. Diuretics may be prescribed to reduce fluid overload. Dietary sodium may be restricted. Kidney function tests should be monitored throughout treatment. In summary, pediatric glomerulonephritis is an inflammatory kidney disorder that commonly follows infection. Early recognition and supportive treatment improve outcomes. Monitor for hypertension and edema. Children who develop glomerulonephritis after a strep infection may have an increased anti-streptolysin O titer. Urine may be smoky colored due to hematuria, and most children recover well with appropriate care and monitoring. Remembering that glomerulonephritis may follow an untreated or partially treated group A beta hemolytic streptococcal infection will guide you to ask about a recent sore throat or other strep infection. Before we test our knowledge, glomerulonephritis can be a complicated topic to understand. Conditions involving the kidneys often have a systemic effect, so symptoms may include findings that may seem unexpected for general renal issues. The following questions will test our knowledge on the material we covered in this resource, so please answer the following 5 questions to gauge our mastery of this material. And don't worry, if we need help, Artemis will be here to guide us. Question 1. Which medication may be prescribed if a streptococcal infection is present? A. Antiviral medication. B. Antifungal medication. C. Antibiotics. D. Anticoagulants only. Well, we know this may be caused by strep infection, which is a bacteria, so I'm going to say C. Antibiotics. And Artemis says we're right. The rationale is antibiotics are used to treat or eliminate streptococcal infections. Question 2. A nurse understands that edema in glomerulonephritis occurs primarily because of A. Excessive sweating, B. Overhydration from drinking fluids, C. Increased insulin production, or D. Decreased kidney filtration and fluid retention. I'm going to say D. Inflamed glomeruli impair kidney filtration, causing fluid retention and edema. Question 3. Which complication is most important for the nurse to monitor in pediatric glomerulonephritis? A. Hypoglycemia, B. Hypertension, C. Hearing loss, or D. Fractures. I'm going to say B, hypertension. Hypertension is a common and serious complication due to fluid overload and impaired kidney function. Thanks, Artemis. Question 4. Pediatric glomerulonephritis most commonly occurs after which infection? A. Influenza, B. Ear infection, C. Streptococcal throat infection, or D. Chickenpox? And I'm going to say C. Streptococcal throat infection. Acute glomerulonephritis often follows a streptococcal infection such as strep throat. Question 5. Which assessment finding is commonly seen in a child with glomerulonephritis? A. Tea-colored urine, B. Excessive thirst only, C. Severe diarrhea, D. Yellow sputum production, and I'm going to say A. Tea-colored urine. Hematuria can cause the urine to appear dark, smoky, or tea-colored. Thank you for your attention to this resource presented by Artemis Interactive Media. This presentation may be used for content review and clinical competencies for pre-conference and post-conference education. This quick timeout can also be used for a short study break. Glomerulonephritis involves more than this QT covers. For more information on this disorder, please contact your instructor and refer to your textbook.